Good morning, Peter Goertz. I'm a psychiatrist, and the question is, do I need psychiatric medication? So you may be asking yourself, do I need psychiatric medication? And what does that mean? What do I need to consider? So what do psychiatric medications do? Chemically, for example, they can inhibit serotonin reuptake, antidepressants, for instance. They can block dopamine receptors. That's antipsychotics, for example. They have various actions in the nervous system at various receptors. Now, that's just the primary effect. Then from then on, it's a domino effect, and they have multiple other downstream effects, which are not necessarily even known. So they have that primary effect, but then, for instance, with antidepressants, it takes weeks for them to kick in. So the downstream effects are the key effects. And it can be tricky to even understand, and I don't think people necessarily understand the downstream effects entirely. So we're talking about depression, anxiety, ADHD, bipolar, so people who have depression and mania, people who have psychosis, hearing voices, feeling paranoid, delusional. Now, those are all things that people can have a lot of distress from, and they can ask themselves, do I need psychiatric medication? So to back up, the bottom line is, if there's no emergency, it's entirely up to you. So no doctor can tell you what to do. No family member can tell you what to do. If it's no emergency, it's entirely your decision. So that's important to realize, and not just in psychiatry. You know, if people say you need surgery, whatever it is, if there's no emergency, it's entirely up to you. You want to get as many facts as you need, and then decide for yourself based on what feels right to you. So that's one very basic thing to remind yourself of. Now, if it's an emergency, if you're lying on the ground bleeding, then it's something that you need to do. You know, if the doctor says you need surgery because you're bleeding to death, you need to do it. Same thing analogously in psychiatry. If you tell the doctor you're acutely suicidal, then the doctor will need to put you in a hospital. So, and if you tell the doctor you're on the verge of, or that you haven't been eating for 3 weeks, then also the doctor will put you in a hospital, psychiatric hospital, and very likely want to give you medication. So if it's not an emergency, again, it's all your decision. You want to look at all the information you can get and realize any medication, any substance is a double-edged sword. You know, if you eat too much sugar, it's going to be a problem. If you eat too much fat, it's going to be a problem. If you take a medicine, potentially can be a problem, especially in higher doses with side effects. There's also a philosophical part. You want to consider, if I take psychiatric medication, am I crazy? Am I psycho? So you don't necessarily want to fall into traps like that, worrying what other people might think. You want to do what feels right to you. And to me, it seems wise to be practical, pragmatic, do what needs to be done at a given time, and things don't have to be permanent. So try not to feel like you're broken if you do need psychiatric medication. People think medications are artificial. They don't want anything artificial in their body, and that's entirely their decision. But again, you want to, in my opinion, be practical, pragmatic. If you're in despair, if you're really suffering, medication can help. Of course, it can also be harmful. So it's really a balance. And you want to have a doctor who spends time with you, explains to you what you need to hear about the medication. You want to have a good relationship. You want to have a doctor whom you trust. And like I alluded to just now, all of this depends on your level of distress. So if you're just mildly depressed, frustrated with life, you probably do not need medication. You might benefit from medication, but you don't need medication. If you're not sleeping, you're not eating, you're hearing voices telling you that you're worthless, then most likely you could benefit from medication and the benefits would outweigh the risks. If you're functioning, if you're going to work, if you're enjoying your family life, your personal life, hobbies, your appetite is good, your sleep is good, likely you won't need medication. Are you using drugs, street drugs, pills? That definitely can interfere with your response to medication. So if you're using drugs and that's a major issue, you probably do not want to start psychiatric medication until you can get off the drugs. Go into a rehab program, do what you need to do to get off the drugs. So if you do not want medication, things to focus on and really take seriously are diet, exercise, some kind of activity that grounds you like meditation, meditation, yoga, tai chi, acupuncture, things that essentially don't have side effects, but that can ground you, can really stabilize your nervous system without taking medication, and all that can help with depression and other symptoms, psychiatric symptoms. Now, as far as side effects of psychiatric medications, they can be serious, very serious even, and they're really worth considering. So it's really a balance. And psychiatric medications can cause weight gain, nausea, tremor, sexual side effects, high blood sugar, high cholesterol, drowsiness, and antipsychotics, for example, can cause tardive dyskinesia, which are movements like twitching that may or may not even ever go away, even if you stop the medication. So these medicines can have really serious side effects. Another thing to consider is potential withdrawal symptoms when you get off psychiatric medications. Now, most of them, with some exceptions like Adderall, Valium, most of the psychiatric medications are not medications that are sold on the street. They're not street drugs, but they can still have major withdrawal symptoms when you stop them, like Effexor, Cymbalta. So that's another thing to consider. Getting off psychiatric medication can be a real problem, and you want to do that gradually. Another thing to consider is if you're working, that if you take, for instance, Adderall for ADHD, it's going to show up in your urine, and you want to make sure that people are aware before you have a urine drug screen that you're prescribed Adderall, that it's not a street drug, you're not using meth, that the positive amphetamine result in your urine is due to taking Adderall. How long will the psychiatric medications take to work? It varies from medication to medication, but antidepressants generally take at least ballpark 3 weeks to kick in. Same with antipsychotics. Mood stabilizers can take some time to kick in, like Depakote, lithium. And another question is, how long do I need to take the medicine? And that's, again, nothing that's written in stone. If you do well with medicine, let's say an antidepressant, in general, it's good to take an antidepressant for about 6 months at least, would be my recommendation if you've done well on it. And do I want to get pregnant? That's another question you want to ask yourself, if at all possible, before you start taking psychiatric medication, because you don't want the medications to affect the unborn baby, and that definitely can happen, and it varies from medication to medication. Some psychiatric medications are relatively safe in pregnancy. Analogously, if you're going to have a child, do I want to breastfeed? A lot of the medicines can be in breast milk. So do you want your infant to get that breast milk with the medication? That could be a problem also. So you want to look at these issues like pregnancy, breastfeeding. Another aspect is medications in general, of course, do not get to the root of things. So if you were raped last month and you're depressed, you're distressed, you're not sleeping, no medication is going to get to the root of that. So that's another thing to consider. Do you want to get to the root of things? Some people do not, and we do need to respect that. Some people, were traumatized enormously in childhood, later on, but they don't necessarily want to talk about it, and they don't want to work through all that. And in my opinion, that needs to be respected. And if those people want to take medications and not have psychotherapy, not talk about all these issues, again, we need to respect that. On the other side of the coin, If someone does not want to take medication and there's no emergency, but they prefer to talk and look at the root of the issue and transform things from there, that also needs to be respected. Thank you very much.